Hello and welcome, everybody. I hope your Flex Day is going well. Thank you so much for being here. My name is Frances Garza. I'm the Benefits Coordinator here at the district office. And what I'm going to present today, I hope is a good topic for you. It's called Connected to Care, going to help you navigate your health benefits for your overall well-being. Some general information. Feel free to add your questions to the chat at any point in time throughout the presentation. Gabby and Lisa are going to be monitoring the chat. They are the two benefit technicians here in our office. Most of the questions will be answered directly through the chat. We'll also address any questions relevant to the whole group at the end of the presentation. If we should end early, you will receive full credit for the entire hour and 15 minutes. So this here, our presentation is just going over prioritizing your own health. So when we prioritize our own health and well-being, we're better able to build connections with students, faculty, staff, and coworkers. By modeling this balance, empathy, and self-awareness, we create healthier spaces, foster stronger relationships, and contribute to a more supportive system and engaged learning community. I'll walk you through your health benefits and explore how you can use them to take care of your health and well-being, both now and in the long run. So I'm going to go over the health plan benefit offerings to our employees. We currently have 5 medical plans for our full-time eligible employees, and we have 4 medical plans for our part-time employees that are eligible under the Part-Time Faculty Health Insurance Pilot Program. So we have 2 PPO plans, both with the Anthem Provider Network. We have the 3 individual Kaiser plans, the Kaiser High, which is a traditional HMO plan, the Kaiser Low, which is a deductible HMO plan, and then the Kaiser High Deductible Health Plan. The high deductible health plans are HSA compatible, so just keep that in mind. If you don't know which plan you are actually enrolled in, you can log into your Benefit Bridge portal by going to your My Portal apps catalog in your My Portal app. I'm not going to actually get into the Kaiser PPO plans as we currently do not have anyone enrolled in that plan. However, if you would like to learn more about this plan, please visit us or plan on attending the information meeting that we're going to have for our part-time faculty on August 18th at 2 p.m. in OAB 114. Or you can reach out to our staff directly by calling 559-243-7100. You also get, as a full-time benefit eligible employee, you also get dental, vision, employee assistance program, long-term disability insurance, and life insurance. So our dental, vision, and EAP life insurance and voluntary LTD all work together to support employee well-being by promoting physical health, protecting financial stability, and providing vital resources for mental and emotional support. So I will be going over those later in this presentation. Voluntary benefits can help employees by giving flexible, affordable options to customize coverage based on their individual needs and life situations. Voluntary benefits can actually fill gaps in your care coverage. They tend to complement basic health, dental, and life insurance by covering things like accident protection, critical illness, or additional life insurance. They give you peace of mind knowing that you have extra layers of protection, which can reduce anxiety about unforeseen health or financial challenges. They also help with work-life balance. You'll see here the Trustmark Universal Life with Long-Term Care. That gives you a unique life insurance option that provides not only permanent life insurance coverage, but also peace of mind later in life with the long-term care rider. It's a type of insurance policy that combines the benefits of permanent life insurance with coverage for long-term care expenses. This is a flexible permanent life insurance policy that provides a death benefit to you and your beneficiaries should you pass away. It also has a cash value component that can grow over time. We also have the American Fidelity and Aflac voluntary benefit products, which can provide short-term disability, cancer insurances, hospital indemnity insurances, and more under American Fidelity. And then Aflac, you have your short-term disability, accident insurance, cancer insurance. The Aflac and American Fidelity benefit products can help with expenses your health insurance doesn't cover so that you can care about everything else. So, anytime you have questions about these policies, you'll want to reach out to the individual vendors directly. I can tell you that right now we are in open enrollment. So, please visit us during an open enrollment period, log into your Benefit Bridge account. If you need to meet with American Fidelity or Aflac to discuss their products and find out their costs, now is the time to do it. All plans that are elected during open enrollment will begin October 1st of 2025. The supplemental retirement plans, the 403B plans, your 457s, those are available to all employees. So if you have questions about those, please contact our district payroll department at 559-243-7100. Now I'm going to dive into the ASCIP Anthem PPO plans. These are the two plans that are available for our full-time benefit eligible employees. So one thing is know how your Anthem ASCIP PPO plan works. You have so specifically to the 90/70, you have your annual deductible, which is $500 per person or $1,000 per family. Now, this is what the insurance is going, or what you have to pay first before your insurance actually picks up. Then you have your 10% coinsurance, which is going to um, be what you pay until you hit that maximum out-of-pocket max for that year. So the out-of-pocket maximum is $1,000 for an individual, $2,000 for a family. Once you hit that out-of-pocket max, the plan then picks up all costs for services at 100% for the rest of the calendar year. Your doctor visits, keep in mind your first 3 visits with your primary care physician are completely free. No copays or deductibles apply. Now, you do have to pay your $20 copay for office visits on that 4th visit. Your prescription drug copays, you have a $10 generic prescription drug copay, a $20 preferred brand, and a $35 non-preferred brand. One of the things to keep in mind with this, if you or your physician requests the actual brand name when a generic is available, you will pay the generic copay plus the difference in costs for that brand or generic. The difference in cost between the brand and generic will not count towards your out-of-pocket maximum. So if you decide to take a brand when there is a generic available and it's not medically necessary, you will be required to pay that difference, and it's not going to count towards your accumulators for that year. There are free generic drugs at Costco. So Costco has a pharmacy. You don't have to be a Costco member to actually use that benefit. You just walk on in, let them know you're here for the prescription, or excuse me, the pharmacy, and they will let you walk back to the pharmacy. You give them a new prescription and they will fill your prescription. Now, some narcotic pain and cough medicines are not included in the Costco free generic program, but that's a great benefit to have, especially if you're taking generic drugs and don't want to pay that $10 copay. Now, down at the bottom, you'll see the 2 websites that pertain to this plan. So you have the anthem.com/CISC, and then you also have Navitus.com. Navitus is a prescription drug vendor for your PPO plan. So anytime you have questions about your prescription drugs, you need to find out if a drug is within the formulary, you need to find out what a copay is, or you just need to verify how much you've paid in your copays for the year, you'll want to reach out to Navitus or log into that website. The anthem.com/CISC, you will notice that CISC logo on almost everything that pertains to your PPO plan. Don't be alarmed. Our health plans are under the CISC umbrella, so it's pretty natural for us to see that on everything that we have pertaining to our plans. Now, your prescription drug does have a separate out-of-pocket maximum from your medical plan. So it is a $2,500 individual, $3,500 for a family. So just keep that in mind. The Anthem High Deductible Health Plan. This type of plan works when you're generally healthy and don't have to visit the doctor often. You will have lower monthly premiums in exchange for paying for more when you actually do need care. Or if you happen to have a coordination of benefits to a richer PPO plan, these plans tend to work well together. Again, this information is when you are using in-network providers, so you have that annual deductible of $1,700 per person or $3,400 per year. You pay 10% of the cost for most services. This is the coinsurance. Your doctor visits are a little different than the 90/70. Your doctor visits are actually, you will pay 10% of the cost after your deductible is met. Your maximum pay or maximum out of pocket for that year is $3,400 for an individual. $6,800 for a family. This is the most you're going to pay if you end up in a tragic situation and you're using hospital services. So if you get a bill for, let's say you're an individual, you get a bill for $10,000. Do not pay that bill because they haven't billed your insurance. So I always recommend do not pay your insurance bill or your bills for your providers until you receive that explanation of benefits from your health plan showing what they picked up and what your responsibility is. Your prescription drug copays on this plan, you actually have a $9 generic and a $35 brand. However, your medical deductible applies to prescriptions as well. So you will go and pay the full cost of a prescription until you hit that deductible. Then you start paying your drug copays. Again, you have the anthem.com/CISC website available to you. You also have the navitus.com website available for all your prescription drug needs. So, things that pertain to both the PPO health plans: physical therapy, occupational therapy, and chiropractic. The first 5 visits of physical therapy or occupational therapy or chiropractic that you go in and see are going to be covered like regular. You're going to have your copays. They don't need a medical necessity review. If you go for that 6th visit, your doctor is responsible to ensure they are submitting medical necessity to American Specialty Health to verify and have that covered under your plan. I actually had somebody in an earlier webinar or Zoom that indicated their doctor didn't do this and they got billed a higher portion. So we will go over something that's going to assist you should that happen and should you need assistance. So acupuncture, you also have an acupuncture benefit under this plan or under both of the plans. You get 12 visits per benefit period. Members on our 90/70 plan have a $20 copay. Your deductible does not apply. Members on our high deductible health plan, you have a 10% coinsurance after your deductible is met. Anytime you have questions about any of these services, please call the member service number on the back of your member ID card for assistance because an Anthem member services representative will be able to assist you. So, certain elective outpatient procedures such as a colonoscopy, upper GI endoscopy, cataract surgery, and arthroscopy can cost up to 3 times more than the hospital than an ambulatory surgery center. These price differences often aren't based on better quality or clinical outcome. Data shows that services at an ambulatory surgery center are generally the same as in the hospital setting, and the average cost is significantly lower. So you can see here they did a cost comparison so that you can see what your plan is paying should you go to a hospital or should you go to an ambulatory center. Now, ambulatory centers, I know we get the question a lot, what is an ambulatory center? Basically what it is, it's a specialty center for a specific condition. So you might have the cancer hospital, or you might have SPOC, which is going to do specific treatments. That's Sierra Pacific Orthopedic. These are surgery centers that are outside of a hospital. Most doctors have the ability to perform surgeries at these centers. They actually have rights to perform surgeries at these centers. So if your doctor is providing you a referral to a hospital to go get one of these outpatient procedures, you can always have that conversation with your doctor to see if they can refer you to an ambulatory center. Now, why is this important? Because the plans actually include a maximum benefit for these elective procedures. So if if let's say you go to the hospital wants to charge you $4,900 for that outpatient surgery, the plan is only going to cover, let's say, 3,000, and then you're stuck actually having to pay the remainder of that bill. You don't want to do that. So definitely make sure that you're going through all the proper steps to talk to Anthem to get your pre-certifications, to make sure that if you need something done at a hospital setting, it has been pre-certified by Anthem so you don't have that out-of-pocket pay. Again, this amount is in addition to your deductible and coinsurance. So you don't want to go through that. Definitely help yourself by making sure that you're using the correct facilities for your outpatient procedures. Again, on your Anthem 90/70 and Anthem high deductible plans, you have the Anthem EAP program. The EAP program is the Employee Assistance Program, and what this does, it allows 6 free visits, either in person or virtual, for yourself and any individual in your household. So it can be a brother, if you have a sister living with you, you have an older parent living with you, and they want to use it, they are free to use your Anthem EAP plan. Now, the Anthem EAP plan provides emotional well-being services. They have online programs, personalized coaching to help you work through your thoughts and behaviors that are affecting your emotional well-being. You can learn ways to manage concerns like your stress, anxiety, depression, and sleep issues, all at no extra cost. They also provide identity theft support. We have heard it's really, really good for those members who may have encountered a situation of identity theft. You can also get 30-minute phone or in-person consultations with a lawyer for help with any legal issues you might have. Should you decide to retain that attorney, you actually get a discounted rate to continue using them. There's also financial planning. You can get unlimited phone consultations with a financial professional to help with any issues such as retirement, home buying, and debt. Again, these services are designed to support your professional and personal well-being. The other added benefit for your Anthem EAP plan, you have Talkspace. This is a 24/7 text chat, phone, or video that you can use, again, completely free for you to use. So please make sure that you're using these added benefits to your PPO plan. Health Advocate. So this is that resource I was saying, if you get like an unexpected bill or you're not quite understanding how your health plans work, this is going to be a go-to. Health Advocate is available for any individuals enrolled on our PPO plans, and what they do is they help you navigate the often complex healthcare system. Their role is to support and guide you and your families in making informed decisions about healthcare, resolving problems, and accessing appropriate medical services. They can help schedule appointments with your doctors or your specialist. They explain medical conditions, treatments, or insurance benefits in simple terms. They assist with insurance claims and billing issues to reduce confusion or errors. They coordinate care between your different healthcare providers. So if you're working with a doctor, an oncologist, and also, let's say, another specialist, they can coordinate all that care for you. It also helps you in making decisions about any treatments or long-term care options that you might have. They are basically your advocate for patient rights. They are going to ensure your preferences are respected. So anytime you have questions, concerns about your PPO plan, reach out to Health Advocate. They have an app, so if you scan that QR code here, you can download their app or you can give them a call directly to speak with any health advocate. And again, any health advocate that you're dealing with, it will be your health advocate until the end of that issue or that matter. So you get to talk to one person, you don't get pushed around to different people who you need to recap your conversation with. No, you're dealing with one person, they're going to be able to help you from beginning to end. Our Kaiser Permanente HMO plans. Again, these plans are available to full-time employees and eligible employees of the part-time faculty health insurance pilot program. So our Kaiser High Traditional HMO plan. This is best for employees who want a peace of mind and easy budgeting with no surprises when it comes to your healthcare costs. There are no plan deductibles. There's no co-insurance, so you don't have, it's picking up 10% of cost. You also have $25 co-pays for office visits, so you're going to know exactly what you pay every time you go in for services. Your maximum out-of-pocket for the year is $1,500 per person, $3,000 for a family. So this is the most you're going to pay if you're using hospitalization services. Again, I like to stress the employees that we see on these plans are generally those who are constantly going in and having care done. They're trying to treat a chronic condition, and they're using hospitalization services very heavily because this plan actually has a very heavy employee premium. So the higher you get in employee premiums that you pay per month, the richer the plan benefits are going to get. So it's really determining what you're comfortable paying at time of service and what you're comfortable paying in your monthly employee payroll deduction. The Kaiser Low is a deductible HMO plan. So this one actually has a higher deductible, but the lower $20 office visit copay. So this helps to keep your day-to-day more affordable. It has that $2,000 per person, $4,000 for a family annual deductible. You will pay 20% of the cost for your co-insurance. Your doctor visits again are $20. Your max out of pocket is $4,000 for an individual, $8,000 for a family. I can tell you, I have this plan. I go in for labs every 3 months. I take maintenance medications. I only pay towards that 20% co-insurance when I'm actually doing anything related to the hospital. So if I'm doing x-rays, if I'm doing MRIs, if I'm doing lab work, it's still not bad. If you're just a little moderate user of the health plans, this might be a good plan to go with. Now, our Kaiser High Deductible HMO plan. This plan right here is actually a good fit for anyone who wants lower monthly employee payroll deductions. You're generally healthy and you're comfortable paying more upfront before the plan actually starts covering costs. So with this plan, you're going to pay at time of service. So you have a $0 employee monthly payroll deduction. Your annual deductible is $3,200 for an individual. You have that 10% of cost. You're paying 10% for office visits. You have the $5,200 out-of-pocket maximum for an individual, the 10 4 for a family. With this plan, I want you to keep in mind the deductible does apply to prescription drugs. So if you jump on this plan thinking, okay, well, I'm going to jump on it, it's $0 a month, no big problem, but I take a maintenance medication every day. You're going to actually pay for the full cost of that medication before your plan starts picking up. So I just want you to keep that one in mind. So Kaiser also offers mental health and well-being resources. I just noticed my typo there. So Kaiser, you get individual therapy with a one-on-one counselor or psychologist as you need. You can also do group therapy, and with group therapy, these are mental health professionals that are leading these meetings where you and members with similar experiences or mental health issues can work on reaching your common wellness goals. It's an opportunity to learn and connect from others, and it's a safe space. So whatever you share in there does not get pushed out to anybody else. It's completely confidential. Kaiser also has health classes that you can join. You can do it in person, or you can do it over the phone, or even online. So they offer a range of services. Of course, it's going to depend on the individual Kaiser facility that you're going to, but these are designed to help you achieve your health goals. All sessions are taught by a team of experts, and they'll walk you through how to make actionable lifestyle changes. Wellness coaching is an added benefit for you. You can get one on one guidance and support from a dedicated wellness coach who can help you set goals, stick to them, and most importantly, see results. You can also do it from the comfort of your own home. You don't need to leave and go actually see somebody. It's just a phone call or a video visit that you're doing with them. You can manage your weight, reduce stress, quit tobacco, eat healthier, and increase activity just by using a wellness coach. You also have additional self-care resources. So there's a wide variety of these self-guided wellness tools, like an online assessment, self-assessment for a total health assessment, just to see where you're standing mentally and physically. You also have digital self-care apps such as Calm and Headspace. With the Calm app, that offers meditation and sleep programs that are designed for you. Now, some features do add a cost to them or do have an added cost to them, but there are a lot of resources that you can use in the app that are free to you as a Kaiser member. Headspace is a one-on-one emotional support coaching and self-care resource that can help with common challenges. You will use Headspace text-based coaching services at no cost and no referral is needed. For members 13 and above, Calm is available to you, and for members 18 and over, Headspace is available to you. One Pass Select Affinity, which is a new program this year as of January 1st, 2025. What this is that you have access to gyms and fitness locations nationwide. I can let you know our Kaiser rep recently notified us that has this pass as an elite member because there's different tiers. She was able to go to several classes of Orange Theory, several Pilates classes, yoga. These are all local agencies that you can go in, and you have a limited number of classes you can do within a month. You can do it here locally, or even if you're traveling, you can still access using these services. So it's a really great benefit. You can also use live digital fitness classes and on-demand workouts. You can get personalized workout builders to try new exercises. You even have a piece where they do grocery and home essentials delivery to help make healthy eating easy for you. And this is available through the Walmart Plus delivery program. So there are different tiers, and so those tiers actually range by 5 different tiers. The digital tier, which is the least expensive, that is $10 per month. The elite tier is $249 per month. All Kaiser members can improve their quality of life with therapies like musculoskeletal issues, including your neck pain, your sports injuries, arthritis, and a lot more. You can have access to chiropractors, acupuncturists, massage therapists, and you can get a discounted fee. Unfortunately, these aren't available through the normal Kaiser facilities, but they do have contracts with different facilities around town that you can go in, indicate you're a Kaiser member, and they will give you a discounted rate to use those services. So all of your medical plans cover preventative care. Now, preventative care benefits, these are really, really great to use. They're something that you don't actually have to pay for. So these are covered at 100% under your health plan, so long as there is not a diagnosis. So with preventative care benefits, early detection, you have better outcomes. So overall, doing regular screenings like your blood pressure, your cancer, your cholesterol, these are once a year things or possibly every single month, depending on your conditions. And then what it's going to do is it's going to give you early treatment. So if something is found, you're catching it early. You're spending less money to manage that. So really these little preventative care benefits, they're not costing you anything, but they are so important to you to make sure that you're maintaining that healthy lifestyle and well-being. Again, some of the preventative screenings are things like the cancer screening. So that's colorectal cancer screening, which usually starts at age 45. You have your mammograms that start at 40. You have your cervical cancer starts at age 21. Your prostate cancer screenings at age 50. There's even screenings for children and adolescents. So we have well baby and well child preventative care benefits. Newborns, there's hearing and metabolic condition screenings that they can do. There's developmental and behavioral screenings, vision and hearing tests, and immunizations. So some value added benefits not to miss. Why value added benefits matter for wellness? Well, it's because they're easy to access. Most of them are digital, on demand, and can be used from anywhere. They support your total well being from urgent care and chronic pain to serious illness and emotional support. They empower employees with tools to manage their health proactively, not just reactively. So these first set of options is your telehealth options. Hopefully you have already used them or you will be using them. These are probably the most convenient. As we continue on through this semester, you're going to get busy, you're going to get stuck in classes, you're going to have days that just seem to go on forever. But just know your telehealth options are usually very easy to access. You either need to download an app and get care, or send an email over to your doctor to get care, or do a video visit just to get care. So these are more common for common colds, common coughs. You have a rash, you need to get some, get a prescription prescribed. Um, for more things that require stitches, those are probably going to be your urgent care, your ERs. But you can see here the different options you have available. Through your PPO plans, you have MD Live. You also have Live Health Online. Both of these options have a $10 copay. However, if you're on that high deductible plan, just know that you are going probably to be responsible for the full cost until you hit your deductible. There's also the Sydney app. So the Sydney app, you can actually log in, check your symptoms, you can chat with the doctor, you can do your checkups through there. You can even get a prescription through your Sydney app. So with all of these options, you do have the option of getting a prescription written to you. So really great benefits. With our Kaiser plans, you have 24/7 virtual care. You can get video visits, phone appointments with your doctor. You can call the advice nurse where you're getting urgent care or immediate care from a registered nurse. When you call that line, if the registered nurse is like, okay, we need to get you seen, they can schedule an appointment for you, or they can tell you to go to urgent care or let you know, hey, we're going to give that authorization so you can go to the ER. Again, if you email your doctor, that is very easy to do. And once you have a primary selected, just email them. Usually your doctor responds within 2 days and can give you any information that you're asking about, write your prescriptions up. Very, very easy. I actually have Kaiser. I really like it because I could go for labs on the weekends. I can talk to my doctor after hours because I'm a normal 8 to 5 person. I really like being able to do things outside of my normal schedule. So you have options. Please be aware that these are available to you. If you have any questions, I will give you a listing at the very end with websites that you can access and start using your resources. Hinge Health. So this is actually very important to our PPO members. If you need physical therapy and aren't able to actually get into the doctor or don't want to go into the doctor, this is a virtual physical therapy app that you can use. It's zero cost to our members on the 9070 plan. It is available for members 18 and over. Those members on the Anthem high deductible plan will have a cost associated with their use under it. What this does is it can reduce any kind of joint and muscle aches, pain and tension that you might have. You get an actual personalized care plan that will walk you through what you might need to do in order to relieve those joint and muscle aches and pains. You will have you can have a clinician actually follow your care. So if you prefer to have somebody actually there with you while you're doing different stretches or trying out different activities, you can choose to do that, or you can do it all by yourself. Just come up, they give you the plan, they show you how to do it in a little simple video, and you can do it all by yourself. The only ask is that you have 15 minutes to do this at least 3 times a week, and it'll help you. Big plus is it doesn't cost you anything. You can do this at your own convenience. You can do it at home. You can do it when you're out at the park. If you're having a picnic and want to do it, it's a really great benefit. So here you will find the website, and that key code is definitely using that CISC group code. Lantern Cancer Care for members on the PPO plans. So this is a cancer, excuse me, this is actually good for employees or eligible enrolled dependents who receive a cancer diagnosis. They don't have to navigate the system alone. These services offer expert guidance during an overwhelming time, helping employees stay focused on healing rather than paperwork. So you will be connected with a care team. And what they do is they will guide you from beginning to end of your diagnosis. So even after you have finished, they will still continue their communications with you if you need assistance. Really, really great benefit to have. I hope none of you have to use this, but if you do, please know it is there. And it's a great customer team that your customer service team that you will be dealing with. So skip the ER for our Anthem PPO members. So when it's not an emergency, do you really need to go to the ER? Probably not. You know, ER costs can shoot through the roof. Anytime you're using hospital services, those costs are going to be sky high. So what you can do is call your primary care doctor, see if they can get you in or see if they can do a virtual or telephone visit with you. If they can't, you have other options. You have the retail health clinics such as Minute Clinics, which can be found at CVS. There's other different clinics in different stores that you can use. What these are, they're physician assistants and nurse practitioners who can help treat minor symptom or minor conditions such as allergic reactions, your sore throats, your sinus issues. They can also administer shots. So if you need a vaccine, they can assist with that. You have urgent care too. So urgent care, those are going to actually be doctors who treat you. They can also help with anything like sore throat, your sinus pain. They help with stitches, x-rays, your strains and sprains. So if you have something that needs a little bit more attention, urgent care is going to be where you want to go. Your MD Live, your Live Help Online, again, that's your $10 copay, but you're able to not leave home and just do it from the comfort of your own home or wherever you're at. If you're in the car and you just want to start that visit, this is another good resource for you. Now, we don't want to take away, if you have a life-threatening condition or a medical emergency, please go to your nearest hospital or emergency room or call 911. For our Kaiser members, when it's not an emergency, what can you do? One, you're going to call your primary care doctor if you have access to them. Some of your primary care doctors might have a direct line that you can reach them. If you haven't gotten there yet, your next step is to call the advice nurse line. This is an 800 number that you get connected to a registered nurse. Again, they start talking about, they triage you, they'll figure out what's going on. Do they need to get you in urgently or can it wait a day? Sometimes you're able to get same day appointments. Other times you might need to wait until the next morning to get an appointment. Still not bad. If they determine, hey, you just need to meet with your regular doctor, we're going to get you the next available appointment. Not a bad option. If you are wanting to do it on your own and just see if you can make an appointment or do a telephone visit or a video visit, you can log into your My Doctor app online or go to kp.org to log into your member account to complete an e-visit and to determine what options you might have. Simple EAP, which is your employee assistance program. Now, this benefit is available to all full-time benefit eligible employees and anyone in their household. So we all work in a campus environment, a higher education environment, and we know what those pressures involved. Whether you're managing student needs, you're meeting your deadlines, you have stress from your classroom, an EAP or employee assistance program can help you stay supported, focused, and well, both for work and for home. So our simple EAP services, what it does is it provides confidential support and resources to employees to help them manage personal or work-related challenges. This can include counseling, mental health services, stress management, financial advice, legal guidance, and even referrals to community resources. It's all aimed at improving overall well-being and productivity. So you can see in these little boxes all the different access that you can get under your EAP program. So this slide here is just talking about what you can actually get when you log into your EAP portal. You can either do that through your smartphone or you can log into simpleeap.com. You can get interactive toolkits, you can get flash courses, you can do educational resources where you can access a lot of tip sheets, you can access articles or videos if that's what you want to use. You can do self-assessments in the system. There's a savings center, so if you log in, go over to that savings center and you can get discounted shopping programs. If you're looking for theme park tickets or you're looking to get pet insurance, this is a savings center that can help you. They have a well-being place blog. So if you're just looking for something to positively impact your health and well-being, just go there maybe once a day and check it out and see what they have to offer. There's also live chat. So if you want to live chat with a licensed mental health counselor, you can do that feature. Again, you have additional resources such as legal assist, financial assist that can assist you with things like getting a referral to an attorney or a financial advisor. These are free 30-minute consults. And then after that, if you decide to retain that legal attorney or that financial advisor, then you will have a discounted rate to retain them. Mindstream is something new to me. It's actually a tool and guidance to help you face life challenges and to thrive. So they have a lot of different resources that you can access using your EAP benefit. This one right here is the mental health navigator. So if you really get to the point where you're like, you know what, I know I need to talk to somebody, but I don't really know what I need. The mental health navigator is actually going to help walk you through that. So what you do is you just answer a couple questions and it's going to give you a customized report to help guide you through the EAP resources. So they will also assist with scheduling care. Telebehavioral video counseling is available to you. So if you're one of those people who I can't physically get into a doctor, but I can do video chat. I'm comfortable doing a video lesson. You can definitely access that through the Simple EAP portal, and you will get in touch with a certified counselor, and they can assist you with all of your needs for your mental health and well-being. There's also text coach. So if you're more comfortable or if you have a dependent who's more comfortable with texting, this is also an option for you. You don't need to leave your home. You can do it 24/7. So it's available 24/7. So if you're having a crisis in the middle of the night, you can get onto your text coach and really get some assistance right then and there. An added benefit, which they added within the last 2 years, is digital cognitive behavioral therapy. So this is to help address stress, depression, anxiety, and general emotional fitness. This is something you do within the app or within the portal. It will help you with how to deal with situations of panic or an anxiety attack. If you're looking for ways to manage your stress, it'll help you with that. If you're looking for to overcome a phobia, it's going to help you figure out a plan so that you can get over that phobia. So another great added benefit through your EAP program. Here is the website. It's www.simpleeap.com. Our group code or company code is STCCD. So you can log into the website. Feel free to scan that QR code to pull up the online or the app through your mobile phone and start using your benefits. So again, I can't stress enough how much mental health resources for employees strengthen not only our campus culture, but in general, our world. We deal with a lot here in higher education. You're dealing a lot with stuff that happens at home. So anything that we can give you as employees a better resource to help deal with that and to deal with it when you're ready. Don't forget that it's here. So you might not need it now. You might need it 6 months from now, or you might need it a year from now. Just always know that this is something that is available to you. So dental, vision, and life insurance. Making time for dental hygiene can be a small but important part of a larger self-care routine. So in or higher education, we deal with teeth grinding. We tend to see that that becomes a norm for some people. You might have jaw pain or dry mouth because you're constantly talking throughout the day because you're an instructor who teaches 8 hours a day. So your dental plan is very critical to dealing with those types of conditions. Just know your plan covers 2 dental checkups every 2 years or 2 cleanings every year. You also have an incentive level plan. What that means is your plan picks up 70% of costs in your first year. Assuming you use it once per year, it's going to continue going up 10% per year until it reaches 100% coverage. The incentive levels will never go down. So if you use it one year, you bump it up to that 80%. You don't use it the next year, it's not going to go back down to 70. It will stay at that 80% until you go back in to use it for services. Another key thing is your dental exams can help detect heart disease, diabetes, and even cognitive decline. So it's interesting because I know a lot of people will say, I'm just going to put off going to the dentist. It's no big deal, but believe me, they can see a lot more with with your health conditions than you can imagine. Vision is another great benefit. An annual eye exam is not only important for your vision correction, but important for your overall health and early detection of serious conditions. Your annual exams ensure your prescription stays accurate, helping you avoid eye strain, headaches, and blurred vision, especially important if you read, work on screens, or drive frequently. Your eyes can even show signs of diabetes, high blood pressure, high cholesterol, or autoimmune disease. So even if your vision seems fine, an annual eye exam is a simple and preventative step to help protect your eyes and your overall well-being. Your VSP plan covers an annual eye exam every year from your date of service. It's a $10 copay. Your benefit gives you glasses, which is frames and lenses. You do have a glass frame maximum. You actually get an allowance, so it's $180 for your frame allowance. And then contacts, you have $180 for that contact allowance as well. For those individuals who don't need prescription glasses, you can actually go and get your annual eye exam with the VSP provider, and then they're going to indicate, hey, you have perfect vision, you don't need prescription eyewear. Then you can go to any VSP provider and get your sunglasses under your care benefit. So that's a really great added service for those who just don't need glasses and would like to get or non-prescription sunglasses under your benefit. Additional benefits under your VSP plan are LASIK discounts. So if you're looking into having LASIK done, it will give you a discount. True hearing discount, which is for our individuals who may need hearing aids or might need batteries. This is a great benefit. And then they also have Iconic, which is an online storefront that they use to get your prescriptions filled and your glasses filled. So really great benefit through your VSP. Our voluntary long-term disability, or LTD is what we call it. This replaces 60% of your base annual salary if you should be disabled and unable to work. So long-term disability insurance is one of the most underrated tools for protecting your well-being, especially your financial, emotional, and mental stability if you ever become unable to work. This is just one of those forgotten benefits. Under this plan, you do have an elimination period, which is the later of the following: the date your benefits under salary continuance terminate, or the date your accumulated sick leave days provided by us, the employer, are exhausted. So I think majority of individuals here are faculty members. So basically you have your sick days. Should you ever go off on an unpaid health leave of absence and your disability lasts 90 days, that's when your long-term disability would kick in. This plan is voluntary. It does have a monthly employee payroll deduction that you would be charged to have this plan. But again, it's an option for you. It's a way to ensure that you have financial stability should you ever end off work on an unpaid leave. Now, our Voya Life and Accidental Death and Dismemberment Plan. This right here is, again, an often overlooked benefit, but it plays a major role in your well-being. Knowing that your loved ones are financially protected if something happens to you reduces anxiety. This emotional security contributes to overall mental well-being, especially for people with dependents. Life insurance isn't just about death, it's about protecting the life and well-being of the people you love and creating peace of mind for yourself. That emotional and financial security can ripple into the many areas of life. So, under your life insurance plan, you have empathy, which can assist from planning a funeral down to the logistics of winding down an estate. Empathy offers an impactful solution to you and your family after the loss of a loved one. Empathy's bereavement support is fully accessible to loved ones and various family members, and you can share and join your account with them. They have a funeral home finder uh, access that you can use. There's also a concierge support. So if you really need to speak with somebody and really try to navigate how to get through a funeral, they will assist you. They have different guides and checklists because, hey, maybe you need a POA, or maybe you need to go through probate for something, or maybe you need to get X amount of copies of a death record. It's going to assist you with getting all that in order. There's also a piece where you can create a digital will. You can even create your healthcare directive and have a power of attorney drafted up for you. So if this is something that you are interested in, this is available through your life insurance policy at no added cost. Your travel assistance program is available to you should you travel over 100 miles away from home. It gives you things like medical emergency transport services, medical assistance services, travel assistance services, security assistance services. So I've had individuals use this. They go overseas or they're out of town, out of the country. They're trying to figure out where the nearest hospital is. They are trying to figure out how to get an ambulance dispatched to them, or they need to figure out where there's an urgent care. There's somebody that's unfortunately needs to find the U.S. Embassy. They will help you with that. The other thing is, if you're planning on traveling out of the country, you can reach out to them and you're trying to find, let's say, you're trying to figure out what vaccines you might need to go to that country or what areas you should avoid. They will assist you with all of that planning. So our flexible spending accounts, these are again, for full-time benefit eligible employees. Our flexible spending accounts are through American Fidelity. So American Fidelity is actually in an open enrollment period right now. So if you are interested in enrolling in a flexible spending account or need to re-enroll for this upcoming plan year, they will be on campus at the various campus locations. They are also hosting virtual hours. So if you need or prefer to do it online through their virtual piece, they can do that with you as well. One of the things flexible spending accounts let you do is you set aside pre-tax dollars from your paycheck to pay for eligible out-of-pocket medical expenses. So the current maximum this year is $3,300 for your healthcare FSA. What this does is it lowers your taxable income, saving you money while covering copays, deductibles, prescription medications, medical devices. Let's say you need glasses or contacts, a mental health service and therapy, dental and vision care. You can get all the care you need without stressing over every bill. Now, a dependent daycare flexible spending account can be used for childcare, after school programs, or care for an elderly or disabled dependent. This lets you work and also focus knowing your loved ones are cared for. This helps reduce the stress of balancing work and caregiving, which is a huge contribution or contributor to burnout. Now, the max for the dependent FSA is $5,000. If you're married and filing separately, it's a $2,500 maximum benefit. Now, these plans are use it or lose it plans. What that means is any unused funds that you've elected to take out over the course of the year, you do end, or they do end, they do go away. You don't actually get those reimbursed to you. So if you're at the end of the year, which we're getting very close to this last benefit period year, you can go to the FSA store through the American Fidelity app. You can buy first aid kits. You can buy, TENS units if you're looking for that. You can buy Band-Aids. You can buy all the things listed here. It's a wealth of things that you can buy. Even if you're looking for personal massagers or heating blankets, you can find them on the FSA store. So if you need to use up your money at the end of a benefit period, the FSA store is a good option. Now, this year's benefit period is going to start October 1st, 2025 through September 30th of 2026. So if you are wanting to sign up, now's the time of year. Make sure to reach out to American Fidelity. Their phone number is listed here so that you can start to look into that and really determine how much money to get pulled out throughout the year so that you're not losing it. Open enrollment. We are knee deep in open enrollment right now. We just started this last week or this week, Monday, and we have been busy. You've probably seen us on the campuses. We will continue to be at the campuses throughout open enrollment. This year's open enrollment is mandatory participation. And what that means is we need you to log into your Benefit Bridge account to complete your elections. You're either going to review them and make everything stay the same, or you're going to make a change to your benefits, whether it be your medical plan or your dependents for the upcoming plan year beginning October 1st, 2025. Now, if you do not complete your benefit elections in Benefit Bridge, you and your eligible enrolled dependents who are currently enrolled will be automatically moved to the Kaiser High Deductible Health Plan. That's the lowest employee cost plan this year. So if you were with us last year it was the Anthem High Deductible Plan, but this year it is actually the Kaiser High Deductible Plan. So if the Kaiser High Deductible Plan is not your preferred option, take action before 4:30 p.m. on August 29th when open enrollment ends. All of our resources, all of our plan documents, how-to guides, the employee benefit guide, links to our different meetings, meeting schedules, American Fidelity, AFLAC information, Trustmark information. It's all there on the open enrollment website. So the link is www.sccd.edu/open enrollment. We will be continuing our on-campus meetings. We go back at it later next week. We also will be doing virtual office hours the week of August 25th. So if you are able to get to us, aren't able to get to us at an on-campus date and time, just check to see if you can do a virtual office hour. If none of that's working for you and you really can't, reach out to us so that we can set aside a time just for you to meet with us. We don't want you to not get the assistance you need during open enrollment. So our part-time benefit eligible employees under the part-time faculty health insurance program, you have a different open enrollment period. You actually start August 11th and it's going to run through August 29th at 4:30 p.m. We will be sending out eligibility notices the week of on Monday, August 11th to your district or campus email address. So pay attention. If you don't get notice that you are eligible and you believe you're eligible, make sure to contact Lisa Rocha Danks at the number here or the email so that we can look into your individual eligibility piece. Again, just like with our full-time employees, if you do not complete your benefit elections in Benefit Bridge during the open enrollment period, you and your eligible dependents will be automatically enrolled in the Kaiser High Deductible Health Plan, effective September 1st. So we don't want that to happen. So please go into Benefit Bridge, make your elections or waive. Our part-time eligible faculty members have a different option than full-time. They are eligible to waive coverage with proof of other coverage. So if you need to waive that coverage this year, just make sure you're gathering that documentation before you go into Benefit Bridge because you will need to upload it at the time you're completing your enrollment. We will run another eligibility report after the semester census date, which is September 2nd, and you will be notified not too shortly after if you become newly eligible. We do have a website here, and I believe Lisa can put it in the chat, but all of our open enrollment information for our part-time faculty and year-round information can be found under this webpage. If you have questions about eligibility criteria, check out that webpage, and we can definitely assist you with also verifying eligibility. One of the key things we hear a lot, and this is a pilot program, it's completely new, it started last year, but we really rely on the campus assistance. So if you're not sure if your load is in our HRIS system, which is a Lucian colleague, make sure you're going to your department divisions and asking them to please ensure that your load is in that system before we run the next census date. So where to find resources? Benefit Bridge is going to be your best friend. So Benefit Bridge is where all of our employees can go on and verify their, or one, enroll in benefits, verify their current benefits that they're enrolled in, look at any plan summaries or documents. That information that I said earlier about your life insurance, having empathy, your funeral planning service, your additional travel assistance services, those portals require certain authorization codes, and those authorization codes can be found in your resource center under Benefit Bridge. So also throughout the year, you can make qualifying life events. So if you have a change in circumstance, definitely log into your Benefit Bridge account to do a qualifying life event. Let's just say you have a dependent you didn't add on your plan and they lost coverage mid-year and now you need to add them. That's a qualifying life event. If you get married, that's a qualifying life event. If you're getting a divorce, that's a qualifying life event. So make sure you're completing your qualifying life events within 30 days from when that happened. Again, if you're unable to get into Benefit Bridge, what we've been hearing from people this open enrollment, if you're not able to get in through your My Portal app, that's because we have an incorrect email listed for you. That's probably because you've either changed your name or you've changed campuses. So if that has happened within the last 2 to 3 months, please reach out to us. If you're having difficulty getting into Benefit Bridge, reach out to us so that we can get that reset and situated for you. Now, the Resource Center in Benefit Bridge is where everything related to your plans is at. So you're currently right now, what you're looking at is the current year's Resource Center coming up for October. It will all change to the 2025-26 plan documents. Everything is there, even plans that you might not have. It's all of the health plans that we offer, all of the employer codes that you might need to get into the employer portals. It's all there. One of the great things about the Resource Center is there's health insurance basics. So let's just say you're not quite sure how your deductible works, or you're not quite sure what an out-of-pocket maximum is, you can go to that health insurance basics tab and it's going to give you information on those topics. Let's say you're Medicare eligible and you want to know more about how Medicare works. You can click on that Medicare tab and it's going to explain to you what Medicare is. There's a glossary. So if you're seeing things in any of your plan docs and you're not really understanding what it is, you can go to the glossary and it'll help give you a definition of what that word is. There's also calculators that you can access. I just went on the other day. There's a life insurance calculator that will allow you to estimate how much life insurance you or a dependent needs. So a lot of good resources in your Benefit Bridge portal. Here's a listing of websites. I know that we will be sending out this presentation to you, but also too, if you want to jot them down, we try to make them very, very easy for you. Like the open enrollment website at scccd.edu/open enrollment. Employee benefits, this is where you can go throughout the year outside of open enrollment to find any of your employee benefit documents as well. There's also the part-time faculty health insurance pilot program webpage that we've created. So if I know that one's not so easy, but I think Lisa can put it in the chat. So that way, if you want to just click on it and go over to it and check it out. Again, we are adjusting it for open enrollment. So come Monday, it's going to look a little bit different. There's also the Anthem CISC website. So if you're a PPO member and you want to go look at your Anthem benefits, that's another website. You have kp.org for our Kaiser members. We have navitus.com for our PPO prescription drug vendor. And then there's Simple EAP. Again, the group code for that is SCCCD. So lastly, before I end this presentation, I just want to let you know that I hope I've given you the guide or the tools needed so that you can feel comfortable using your health benefits to support your overall mental health and well-being. I can't tell you enough, you're your own advocate. You have to fight for your own health. Don't forget to take care of yourself. We definitely want you here. We want you to stick around for a long time, but you have to be accountable for your own health. So make time for you. Use your resources that you can use through your digital apps like your Calm, your Headspace, your EAP. For our PPO members, if you're familiar with the apps, you have Sydney, which is available to you where you can access all your plan documents, a virtual ID card. Kaiser, you have a wealth of apps as well. My Online Doctor, your medicine app. You can also do the Calm app, the Headspace, like I said, but definitely do and maintain your own health and well-being. Because again, in doing so, you're maintaining your power to connect meaningfully with your students, your coworkers, your faculty, and staff. So questions, I'm going to defer to the chat questions, and then we'll open it up to anybody else who might have questions. I didn't get them in the chat. Here, though, is our email address. We ask that you email our general email box because all three of us are checking it, including individuals within our HR department. Also, if you need to reach us, reach out to the main line because if for some reason we're not here, there might be somebody else who can assist you. We are on the road right now for open enrollment. So again, we will be at the individual campuses. So please come and see us. Even if you just want to say hi, we love interacting and networking and meeting all of our faculty and staff. So next I will leave it to our chat. Lisa or Gabby?
So I had one question, Fran, and I'm not sure we have the answer to it, but it was during your EAP section where Nancy was asking if they cover interpreting services for the deaf faculty. And so I'm not sure if we have that answer or if we'll need to inquire.
We will need to inquire. I haven't had anybody ask, but we will definitely find out and get back to you. So, okay, I think we're winding down. I thank you so much for being here for this presentation. I hope your flex day is going well and hopefully you get a little energy boost. I know we're coming closer to that midday, but anytime you have questions, our team is here to assist you. Again, you have a wealth of resources. Just remember to use them. If you're also, hey, you're not going to use something right now, 6 months down the line or a year down the line, you're like, hey, I remember them talking about something, but I'm not quite sure. Log into your Benefit Bridge account, go to one of our websites, or just reach out to us directly so that we can help you. We don't want to make anything hard for you. We want to make it easier, just to ensure that you're meeting your overall well-being and mental health journey. So we're here to help. Thank you so much for attending.